talking about lower back pain is very relevant. The WHO estimates that around 820 million people across the globe suffers from lower backache. There are mechanical reasons due to which you get back pain. There are inflammatory conditions that cause back pain. There are degenerative conditions that cause back pain. Somebody who's working in an IT field might have to sit for longer hours. If you're in college, you might have to sit in for a very long hours in the college. That might all cause inflammation in the back. Why Ayurveda do treatment in the first place is to keep a human healthy and happy. So you cannot be healthy and happy really unless you feel well.
Dealing with back pain while carrying out daily activities is a very hectic job to do. But there can be a lot of medicines that are prescribed to you, but it may not be very effective for you. But Ayurveda comes into the picture now. Ayurvedic medicines is viewed as the best course of medicine to relieve the back pain you have. Arya Vaidya Pharmacy finds the right way to reduce your pain in a very effective manner with the best remedies possible. It focuses on Ayurvedic remedies and pain management. Hello everyone, I am your host Hiran Dubey, and today in the Meri Saheli's Health Podcast, we are going to talk about back pain. And here as guests, we have Dr. Karthik Krishnan, who is the Vice President of Arya Vaidya Pharmacy. Welcome to our show, Dr. Karthik.
Thank you.
Dr. Karthik, how important is it in today's generation to talk about lower back pain, and what are the actual causes that we actually face issues like lower back pain?
Well, Hiral, I think talking about lower back pain is very relevant as of now. The WHO estimates that around 820 million people across the globe suffers from lower backache. And it's not just them. When somebody gets low backache, it affects their productivity. If you're a homemaker or if you are somebody who's going to an office to work, it affects your productivity at home and also at home. So therefore, I think it's very important that we discuss about the impacts of low backache and how it affects a family, not just a person. If you look at the general cause of low backache, that can be broadly classified into either mechanical or degenerative, or sometimes it's inflammatory. So mechanical include those diseases such as lumbar spondylitis, lumbar spondylolisthesis, etc. Sometimes it's more degenerative in nature. As you age, you have certain pathologies creeping up in your spine. So that can cause certain low backache issues. And sometimes it's inflammatory in nature because of inflammation, which arise out of our habits, our lifestyle choices, or our occupation, etc., which can produce certain inflammations in the lower back, which can cause illnesses and pain.
Okay. Once that we know we're talking about back pain, I really wanted to know that what are the causes that people are actually getting into like back pain?
Well, there are many causes for back pain. To start off with, if you can look at broadly, there are mechanical reasons due to which you get back pain. There are inflammatory conditions that cause back pain. There are degenerative conditions that cause back pain. Out of this inflammatory, degenerative, mechanical, I think today inflammatory and mechanical conditions are getting more and more. Degenerative has been there for a very long time. This is the kind of back pain that you get because your structures of your spine get degenerated over time. But today, the prevalence of inflammatory back pain is increasing. If you look at it, the prevalence of back pain as such is more today. WHO estimates that around 820 million people across the globe are affected with low back pain. Right? And it's not only just about having pain, it actually debilitates a person. It hampers their ability to do a function, a job, or to carry out their household chores and everything. So the disability is not just limited to one person. When somebody has a low back pain, especially maybe a woman, a homemaker has a low back pain, it affects the family altogether. So the causes of the back pain, like I said, are majorly mechanical, inflammatory, and degenerative in nature. And sometimes it can happen because of trauma, as in fractures, or due to accidents, or unnatural postures, etc. But the effect of that back pain is not just limited to one person, and the cause is more widespread.
So basically, we can also say that actually it's a blend of other things. It's just not one thing we focus on. We always think that we're maybe, like working out too much, that's the reason. But actually finding out the reason is a very big task to do. So, there can be multiple reasons.
So WHO ascertains that there are two major categories of lower back pain causes.
Okay.
One is specific, one is non-specific. So like we said, most of the time it's a blend of many things.
Correct.
So 90% of the cases is usually non-specific. You cannot pinpoint this would be the reason for it. Yes, you might get into a diagnosis, which is true.
Yeah.
For example, you can get into a lumbar spondylosis, spondylolisthesis or spondylitis, or maybe an osteoporosis as a diagnosis for the low backache, of course. However, the cause, if you look at it, might be non-specific. What exactly contributed to this condition? Might be many things. It may not be one thing. The degeneration, which is even now prevalent in young people,
Correct.
might be because of several reasons. Maybe it's because of the wrong posture. Maybe it's because of lack of activity, or maybe it is because of excess activity. But it's very difficult to pinpoint to one. You could say it's because of the lifestyle as such. But as I said, 90% of the causes are always non-specific.
Non-specific. When you talk about younger generation, because I also belong to that strata, I really believe that when I see my parents working out or maybe just walking, the complaint from them having a back pain is less than me complaining having a back pain. So somewhere I believe that being a person working, going here and there, it's just me and my college. There's very less activity, but still I have a lot of back pain. So what can be the major reasons why Gen Zs or the people who are very younger are facing these kind of issues?
Well, it is true that the prevalence is actually building up in youngsters. Back pain among senior people is usually because of degeneration in most cases, right? But youngsters do have their bigger share in prevalence as of now in the pie, basically because there is a lot of inactivity which leads to inflammation over time. There are a lot of ways in which they engage in wrong postures. For example, somebody who's working in an IT field might have to sit for longer hours. If you're in college, you might have to sit in for a very long hours in the college, right? In classes and everything. That might all cause actually inflammation in the back. It can actually, if there is already a pathology which is building in your back, it can actually contribute to that pathology. Moreover, there are other factors where Gen Z is more vulnerable. For example, intake of water is one thing. I cannot stress enough the importance of drinking water for the health of your back, right? You know, our spine is built with vertebrae and discs in between. When we call this disc, which you might have heard of, are actually cartilaginous structures. So cartilaginous structures are very soft and very rubbery. If you want to get a feel of it, you have to touch the end of your nose because it's made of a cartilage, right? It's kind of very rubbery, it's soft, and it's 80% water. So when you don't drink enough water, the discs get dehydrated. And because it gets dehydrated, it can go into desiccation or degeneration. Now, that is one of the main causes of low back ache in youngsters right now.
Correct.
Okay.
So, you know, it's a very big shock for me, like thinking about water and back pain, because it's something I can't even think of relates at a point. But that's a very wonderful point that you mentioned, that it's somewhere relevant to each other.
Yeah. And hydration is very important, not just for bone health. Yes, of course, for all the bodily functions, we are especially made of water. But, you know, the discs need water to have their shape. They are very elastic in nature. They need to bend, twist, and according to our movement. So to keep its ability to move, it needs to retain its structure, for which water is very essential.
Okay. So then maybe you're also claiming that because I don't drink good amount of water, that is the one of the reasons I can have back pain. So then I also think about it that we are actually making a lot of mistakes when we talk about back pain that is actually leading to back pain. So what are these common mistakes that people are actually making that causes back pain?
So here we discussed how the reasons of back pain are always non-specific, meaning it's not always, you can pinpoint it on certain points.
Correct.
But there are certain things which we can avoid to prevent back pain. Okay. If I think on the top of my head, the number one thing that we do is bad posture.
Bad posture.
Bad posture. So if you look at people and in general as such, you know, we tend to be in a very comfortable space, in a comfortable sitting posture, or when we are lying at our home, you know, people who want to watch TV and all those stuff.
On the couch.
On the couch, you know, you understand how these people are generally in a very bad posture.
Correct.
Okay. So not having a spine straight is actually a bad posture for the body. Okay. Having our spine straight and at the same time relaxed and comfortable has its own advantages to keep the spine straight, to have good circulation, to have good digestion, etc. But it's not possible all the time to keep your spine straight. That we totally understand, right? So
Yeah.
you can't be in a straight spine position
All
all
the
the time.
time.
I have seen doctors and the so-called health influencers advising you to have a straight spine position all the
All
time.
the time.
All the time. But you have to understand that is not going to happen for
Correct.
with
Just be
the
more
population.
cautious about it.
Yes, so be more cautious about it. Even though you are in a sitting or lying down, make sure that you're comfortable, your spine is comfortable,
Correct.
right? Not to have any twisted position which makes strain or sprain to your back.
Correct.
Would be great. Okay, that's
Yeah.
number one mistake that we do. Second thing, I think we already discussed about the importance of hydration. The other thing is people who are engaged in activities of lifting weights. So this is applicable for gym goers. This is applicable for those people as a part of their occupation who have to lift heavy weights, right? So we have heard from a child, lift with your legs, not with your back.
Correct.
So this anecdote originated because lifting or putting more pressure on your back while lifting weights will actually give more pressure to your the joints of the vertebrae and can lead to a lot of trauma, including spondylolisthesis, which is where your disc slips over one another, or it can lead to compression fractures of the spine if you do it for long enough. So these are very common pathologies that you find in low backache, which could be avoided if we are mindful about the way that we lift objects or we exercise or we work out.
Okay. So basically, people who are going to the gym, what would you tell them? What is the right way? If they have to lift anyway, what is something they can, actually not do? Means.
So if you're somebody who is going to the gym for the first time,
Correct.
or if you're not very experienced in deadlifting weights and everything, make sure you actually have the service of a trainer, which is very important.
Okay.
You follow or you have a mentor to actually correct you in your posture when you're going to a gym. Make sure the way that you lift weight is not actually putting too much pressure on your back, right? Too much stress on your back. It's very important to have to avoid injuries. So I would suggest that if you are somebody who is regularly gym going, make sure that you're doing it the right way. Have a mentor to correct your posture. And if you don't have a mentor as of now, get a trainer for at least once to make sure, you're doing it
Just
the
so
right
that you know what's the right thing to do.
way. Of course.
Understandable. There's also there's one more thing that comes to my head is that whenever we have back pain, we just go to random medicals, we get a painkiller, we just pop it. So, it's very easy for us to get rid of it. We actually don't focus on what's the issue and we just want to get rid of it. So it's a very soft and a very short-term thing that we do. So what is your take on that?
So here you have to understand, popping a pill, especially a painkiller, is not gonna solve the actual issue.
Correct.
So like we discussed, low backache can happen because of various reasons. And just taking a painkiller is not to resolve those issues. So the problem here is, popping a painkiller is like what I would say is like a band-aid attitude. Meaning you are just solving the problem for now and only for now.
Correct.
It will always pop back when the effect of the pill is over. So unless you address the actual pathology, which is actually maybe a spondylitis, or maybe a fracture, maybe a disc prolapse, whatever that is. If you don't actually focus and address that pathology, the lower back pain is going to come back. So popping pills, especially without prescription, without medical supervision, will eventually end up in causing you more side effects rather than giving you benefits. The benefits are usually temporary when it comes to popping a pill like a painkiller.
Correct.
But the risks are long term. So it is very important that you consult a doctor and make sure that the painkillers that you use are properly prescribed, and at the same time you address the actual cause of the disease.
Correct. There can be times that the issue is maybe a very big issue, but we just take a painkiller and we just neglect it, and then it just piles up at a point and you can actually damage yourself with it. Yeah,
of course. See, we see a lot of cases where people have tried a lot kind of painkillers. So usually what happens is you try a painkiller. After a time, when it doesn't work because you're not actually addressing the root cause of the disease, after a while, what happens? You might need a stronger painkiller and a stronger painkiller, and that vicious cycle never ends.
Correct. It's a loop.
It's a loop. It will never end. So until and unless you actually address the baseline issue, what is causing this pain,
correct,
the disease is not going to heal. It's a management. You have to understand there's a difference between managing a disease and healing a disease. So I would say the wonder of Ayurveda is the main focus of Ayurveda, if you look at across the board, is and always been actually healing the cause of the disease.
Main root cause.
Yes. So that is what we call as healing the disease, right? Otherwise, you're just managing it. Taking a painkiller to address the pain is actually managing the pain.
Correct.
You're not actually getting rid of the pain.
Yeah.
Right? You're not actually solving the issue there. You're actually just managing it.
Yes.
But the real focus of Ayurveda is at healing.
Yeah, to delve into the real actual roots and getting rid of it.
So if I say this would be the main difference between Ayurveda and the Western kind of medicine, what we today call as the modern medicine allopathy,
Correct.
is that we are not just only focused on managing the disease. Ayurveda for centuries has been looking at what is causing the disease, what are the root causes of disease, and how we can make changes in our diet, in our lifestyle, and maybe also have some remedies to actually correct this, this mistake that has happened, which causes the disease, or the pathology which is causing the disease. So that is a difference in the philosophy of medicine as well, not just limited to the approach of Ayurveda.
Okay. So there's something that I've read about. It's known as Ayurvedic Doshas. I just know the term. I've never heard about it. I mean, I've read about it, but there are no one actually talking about it. There are no podcasts, there are no reels about it. So I would really love that if you tell me what is actually Ayurvedic Doshas and how do it relate to the back pain.
Okay. In Ayurveda, we talk a lot about doshas. I understand how sometimes that could be very complex and technical and not very simple for a layman to understand.
Correct.
Okay, let's try to break it down.
Okay.
So we need to understand that Ayurveda relies on a three-dosha principle, the three-dosha principle, to understand the world as is, not just diseases, the world as is.
Okay.
So to understand three-dosha principle better and in a simpler way, I think we should go back to the time when it was conceived. So the three-dosha principle was in existence at least well before, as we know, before 5th century BC, because textbooks before the 5th century BC explains about Tridosha principle. So it has a lot of philosophical base out of the Sankhya, Nyaya, Vaisheshika philosophies, which are prevalent in ancient India. But if you think about the man who lived at the time, 5th century BC or above, you need to think how he viewed the world, right? Let's say, for example, if you want to understand the world he lives in, he need to look around him, he need to understand, he need to gather knowledge. At that time, without the scientific advancements that we have today, the only way to look at the world is through our 5 sense organs, right?
Correct.
We gather knowledge through the 5 sense organs.
Correct.
So the ancient man understood that the qualities that is affecting him while he's living in a riverbank, or where he's in the top of a mountain, or he's in a seashore, are quite different, right? Have you ever trekked? I hope you've gone for trekking and stuff.
Yeah, I have.
So what do you feel when you trek the mountain and you reach the top of it?
It just feels like, I've just accomplished something.
Something, of course. So usually the feeling is more like you feel light.
Yeah, I do
you feel
like
light.
Worth it.
Worth it, of course. So it's not the same way that you feel when you're on the valley.
Correct,
right?
obviously, yeah.
On the top of the mountain, you feel something different.
Yes.
And that's not just psychological. You also feel something in your body as well.
Correct.
Right?
Yeah.
You've trekked so hard. You feel light. If you rest enough, you see that you're feeling more lightheaded.
Yes.
You're feeling more calm.
Connected to the nature and
Of
stuff
course.
like that. Yeah.
So the ancient man also understood that there are certain qualities that he feel in his body, depending on the geography that he is in,
correct,
depending on the climate that he is in. For example, it's monsoons right now, right? The way that you feel about your body in the monsoons and the way that you feel about your body in summer are quite different.
Very different.
Am I true?
Yeah.
Okay. So it means that the seasons are affecting us.
Yes.
The geography is affecting us.
Correct.
And the presence of water bodies affects us. It's not the same way that you feel near a seashore.
Correct.
Your body feels different, right?
Yes.
So all these nature elements are affecting us. So he understood if you want to be healthy and if you want to have a very, how do you put it, a holistic life along with nature, he need to understand these natural elements and actually manipulate them as well, right? Or to live along with them. So for that, he made a way to understand these natural elements, and those were called as qualities, right? You can see qualities in all of them. For example, the air in the top of the mountain is very light.
Correct.
The air in the valley is more thicker,
yes,
right? You feel the air is more dense during the monsoons.
Correct.
The air is more cold and damp. During summer, the air is warm and light.
Correct.
Right?
Yes.
So there are qualities in climate, which the climate provides. There are qualities that geography provides. There are qualities which water body provides. There are qualities in that effect the sun and the moon provides to earth. So they started understanding their world through these qualities. And for the ease of understanding them better and to live along with them, they actually divided these qualities into 3 boxes or 3 categories. Okay. The first one is called Vata. Vata.
Yeah.
Okay? So they included all the light qualities, the qualities of air, the qualities of dynamic, the movement, quality of cold and dryness into Vata. The second quality is called as, or second box of these qualities are called as Pitta.
Yeah.
Okay. It includes heat. It includes warmth. It includes everything that is sharp, acting.
Correct.
It includes everything that is transforming in nature. Okay. So they called it Pitta. The third one is called Kapha. Kapha actually gives a structure. Everything that is cold, hard, strong, immovable or not very movable belongs to Kapha.
Okay. So there are like 3.
3, right?
Vat, Pitta and Kapha.
Yeah. So then they call this boxes. So these boxes contain qualities. They call these boxes doshas because in our body, these qualities, when they change, can create illness in our body.
Correct. Yes.
Since they are that which causes dosha, or in Sanskrit, you would explain dosha as dushana titi dosha, that which vitiates.
Correct.
Right? So when these qualities, when they are out of their place, they are out of balance, they create uncomfortable a feeling of illness inside us.
Yes.
So therefore, they were called, these boxes were called as doshas, and just for that. Hence, the 3 doshas, the Vata, Pitta, Kapha, right?
Yeah.
And we use this to study the world and study the human body and the mind and to understand how diseases happen in the body, because when certain qualities change in the nature, the change is reflected in us as well. So when there is monsoon, we are more vulnerable to get a cold or a cough or a fever, right? Or a flu, because the qualities of the nature is changing, right? And that will reflect in our body as well. So we use these 3 doshas to understand pathologies in the body. But in truth, Ayurveda can use this 3 quality or 3 dosha principle to understand everything around us, right? And we use this extensively in diagnosing diseases. For example, we are talking about low back pain. So if you look at how sciatica is happening, we would now to understand using the dosha principle, what doshas are actually getting vitiated when you're getting a sciatica, right? So in that way, we can actually come up with ways of understanding the disease, the human body and our nature to treat that illness or to correct that imbalance of qualities.
Because earlier I knew what is Vat, Pitta and Kapha, but I did not know it's also known as a Ayurvedic dosha and it's imbalance. So it's a very nice concept that we really discussed. And I think our viewers are going to get something extra which is not already on the social media platforms. In the middle of the conversation, you somewhere mentioned sciatica. So I really wanted to know what's the difference between sciatica and a lower back pain.
Okay. Sciatica is an associated complaint of lower back pain. Many people have sciatica, also has lower back pain, vice versa. So sciatica is where you experience pain in the back of the lower back of your body, and the pain radiates down your leg. Specifically on the back of side of your leg, okay? Through the buttocks, through the thighs, to the back of the leg.
Correct.
This is because when there is a pathology in the spine, such as a vertebral disc prolapse, right? It actually causes compression on the sacral nerves. So the sciatic nerve, which originates in the sacral area of the spine, which goes down through the buttocks, through the lower back, through the calves and everywhere, it gets compressed, it gets irritated, and it can cause tingling sensation or sometimes even true pain on that region where it is supplying, right? So the pain can happen in the low back ache and the buttocks, in the back of the thighs, maybe at any point where it is passing. But the back, of course. So this is called sciatica. So lower back pain can be of many, many causes, but sciatica happens because of this specific pathology on the lower back where the nerve is getting pinched.
Okay. So why is the nerve pinched? Is there some reason, a vigorous activity or something like that?
So vertebral disc prolapse can cause this. An inflammation of the lower spine can actually cause this. So any reason that will create that pinch or that inflammation of that sacral nerves can actually cause sciatica.
Can lead to that.
Can lead to sciatica.
So when we talk about Ayurveda, how does the Ayurvedic practitioner actually diagnoses lower back pain in a body?
Okay. So when you go to an Ayurveda practitioner, the first thing that the Vaidya gonna do is to have a consultation, a long consultation, right? So Ayurveda Vaidya looks for the causes of the pathology. So what we are looking for is the actual cause, which has caused this set of symptoms. So you might be going to an Ayurveda Vaidya with a lower back pain. Maybe if it's sciatica, it might be tingling on the legs or stiffness of the back. There are many ways in which the lower back pain or the pathology at the lower back can actually manifest. For some people, it's just difficulty to move, stiffness, right? For some, it's pain in the back. For some, it might be a nerve pinch, which is causing tingling sensation.
Or maybe actual pain.
Actual pain, of course.
Yeah.
So a Vaidya, a doctor, would be looking at the cause of the pain. He will understand what is causing the pain, the nature of the pain. So in Ayurveda, we understand pain through different modalities. There are different kinds of pain that we can feel, like a burning kind of pain or like a pricking kind of pain. There are many kinds of pain, and each of them is important to understand so that we understand which dosha has gone out of balance in a particular case, or which set of doshas have gone out of balance. So we would understand that. For example, if you have a stiff back and along with pain, okay, we might ascertain that something which has gone out of balance would be a vata and a kapha dosha together at the same time. So we will understand what is happening, the pathology which is going on, which doshas are involved in that pathology, and then we'll try to understand the general health of the rogi. So the treatment is not just for the pain, it's for the health, right? It's health of the person altogether. It's not just for the lower back ache alone. You get cured out of lower back ache, you might have a gut issue. That's not the way that Ayurveda treats its patient. It's a holistic approach. So you cannot be really happy. So if you look at why Ayurveda do treatment in the first place, is to keep a human healthy and happy. So you cannot be healthy and happy really unless you feel well.
Well, correct.
Right? So the idea is to understand the different aspects of your body's metabolism as well. So we look very closely into digestion. How is it happening? How is your digestive process? Are you feeling hungry at right times? Are you eating healthy? Is your bowel movements and everything are okay? Is your sleep doing okay? How are you feeling mentally? Are your relationships fine? We look into all those aspects.
In one consultation.
In one consultation. This is how usually the right Ayurveda consultation would go for, right? We would look into different aspects of your life and understand what is actually causing you unwell.
Yeah.
It might be sometimes psychosomatic in nature. It might be something related to your food. It might be something related to your workout. So we would love to find out what is actually going wrong, and we will try to bring that back. Because the idea is that you have to understand, if health is a highway, medicine is a remedy. It's a way to actually get back into that highway when you have gone astray from it, right? It's a remedy or a medicine is not there to keep you healthy. That's the wrong way of watching it. Like we talked about the popping pills thing.
Correct. Yeah.
So health comes from having the right lifestyle, having the right kind of diet, having the right kind of thought process. So the purpose of a consultation and diagnosis is to understand what is it that you're doing wrong and how can we correct it.
What caused the imbalance?
What caused the imbalance and how we can correct it. So to understand that, Ayurveda physicians might use an extensive questionnaire to understand what is going wrong and to find what is really happening and how we can correct it. They might also rely upon modern technology of diagnosis as well. For example, in a low backache, the Vaidyas might prescribe you with an MRI or a CAT scan so as to understand what is the pathology right there in certain cases. But it also includes sometimes traditional ways of understanding, such as Nadi diagnosis, a pulse diagnosis, or to understand what is your diet intake, etc. So all those things can also happen along with it, so that we can actually plan a treatment, right? A protocol to alleviate your symptoms, to correct it.
So basically, when you talk about pulse, they actually check everything, which makes me understand that your lifestyle, is there any trauma, what do you eat, where do you go? So it actually involves all aspects when you go to Ayurveda person.
Yes.
Okay.
So it involves a lot of aspects of it. So to a first timer, it might be a bit overwhelming, but we have to understand only by actually curating all these aspects of our life, we can truly feel healthy.
Correct. Because it's maybe a very big session when you talk about it. So people might be like, why are they asking me too many questions? But yeah, it is important. It is relevant.
A true Ayurveda consultation might feel very different from a doctor's consultation that you are accustomed to, because a doctor's consultation usually lasts sometimes minutes to sometimes
5 to 15 minutes is a maximum.
That's what you see.
Correct.
But if you're going to an Ayurveda physician, sometimes this consultation might last longer and might involve deeper conversation about you, your life, and as such, because it's very important to understand where is the imbalance so that we can make you well.
Correct.
Right. So the whole purpose, like I said, is to make you healthy and happy. And that doesn't happen by just prescribing medicine.
Pills and stuff.
Of course.
So now that we understand that, how does a Ayurvedic practitioner also checks that what is the issue, they've diagnosed it, but what are the treatments that are being suggested to the people who are actually facing low back pain?
Okay. The treatment of low back pain really depends on the cause that you said. And it can actually differ from person to person. As such, treatment might also differ from person to person. An important thing to understand when you go for treatment in Ayurveda is that it is heavily customized. So the treatment for one person might not fit another. That is why an Ayurvedic doctor consultation is at most important, right? When you choose Ayurveda as a stream of medicine for your treatment. So once your doctor has consulted you and has understood what is the pathology that is going on in your body, what are the imbalances, he makes actually a tailor-made protocol for you. And that protocol would usually involve diet, lifestyle changes, some sort of workouts, maybe if it's allowable. Sometimes, you cannot do a workout when you're having a low back pain. Sometimes you might need rest. So a proper lifestyle change or a proper workout protocol will be also prescribed. And then comes the medicine. So these are the common elements of a treatment. It's not just about prescribing a pill or giving you a treatment. Talking about treatment as such, treatment can have various elements on its own. For example, if you have the pathology that you have is manageable by actually taking Ayurvedic medicines, herbal medicines, you might be prescribed with those. If it needs much more serious attention, much more deeper care, you might be prescribed with certain procedures of Ayurveda, which include certain kind of massages. There are different kind of abhyangas, what we call as massages, potli massages. There is Panchkarma treatments that might involve cleansing, purificatory therapies, etc. So the doctor might prescribe any of those depending on the pathology that you might have. So those comes to the treatment. And sometimes if a pathology is much more serious, need more care, you might need to go admit in an Ayurvedic hospital to get treated as well. Sometimes you might be able to go to a day treatment center and get your treatment done and come back. Sometimes medicines are enough, like I said. So that's the treatment part of it. And like I said, there is dietary part of it. There is actually the lifestyle modification part of it. You might be told to follow certain diet protocols. It is very important when you have low backache not to get constipation or bowel issues, because having bowel issues and constipation would actually worsen the low backache that you're having. So certain diet protocols might be suggested, which makes your digestion much more easier.
So basically, when we talk about the treatments, you mentioned that we have to sometimes get admitted in an Ayurvedic center or something like that. But whenever we think about Ayurveda, we always feel that this is a very slow process. It might take like maybe a year or something. So what is the actual duration? Is it a myth that it takes time, or it is actually it's gonna take time?
I would say, I personally think, and with my experience, that taking long time to see result in Ayurveda is a myth, right? If your diagnosis is correct, if you're going to the right doctor, your diagnosis is correct, and the right choice of herbs have been chosen for you. I think with scientifically evidence-based Ayurveda practice, you can find results much, much more faster. Faster than you imagine, right? It's not at all a slow process. So if you take medicines of Ayurveda, they work as fine as any other stream of medicine, right? They give you relief from pain. They address the root cause, and it works in phases, of course. But however, it actually gives you relief from the pain, and it also addresses the root cause very quickly. So it is not always true that medicines take a very long time. Of course, in certain chronic cases, there might be situations where you might have to take medicine for an extended time. But however, low backache is such a case where if it's manageable, it could be healed or managed within a very short period of time.
It also depends on how extensive is your problem.
Of course, it all depends on the pathology. Like I said, there is no one fit for everybody. Therefore, you might have to discuss with your Ayurveda physician about the treatment options,
Correct.
the duration of it, how long it will take to make effect and everything. But however, the thought process that it might take very long time is a myth.
It's a myth.
It's a myth, of course. And you can actually find results within a very short span of time if the right medicines are used with the right diagnosis, the right dosage and all. Of course, like I said, Ayurveda treatment is not just about popping pills.
Yeah.
It's about actually following a lifestyle pattern as well. So the dietary choices that you make, the lifestyle choices that you make has a huge say in the effectiveness of the treatment. So just taking medicines and expecting for it to work wonders might not be true or might not be realistic when it comes to Ayurveda. You might have to follow the dietary protocol and the lifestyle suggestions that your Ayurveda doctor is making.
Correct. But when people actually think about Ayurveda, there's also one more thing that they think about. If their issue is too much, for example, a person can't move because of the lower back pain, they think that if we go to an Ayurvedic practitioner, it is a very not so right decision, because it's better to go for a allopathic consultation rather than an Ayurvedic consultation. So if the issue is too much, does still Ayurveda remain an option for a person? Is it late to visit Ayurveda if you have too much back pain?
I would say you are never early nor too late to visit an Ayurveda physician if you're low backache. At any stage.
At any stage.
At any stage, Ayurveda can help heal you.
Okay.
Right? Maybe it's something very acute. Maybe it's something very chronic. You can go to an Ayurveda physician, get a consultation, understand what stage you are, what is the pathology, what are your treatment options, discuss with him or her, and actually come about a proper solution. Okay. So that is possible at any stage.
At any stage.
You don't have to think that, okay, this might be advanced. Ayurveda treats a whole spectrum of diseases from a simple flu or a cold to cancers and all those stuff today.
Correct.
Right?
To serious issues.
Very serious issues. You have to understand it takes care of a very long spectrum of illnesses as of now. So therefore, Ayurveda can actually help you with low backache, and the success rate is quite good with Ayurveda.
Okay. Also, you mentioned priorly in a conversation that you have to have right digestion and proper stomach activities to actually maintain the good health of your lower back.
Sure.
But people also have a myth, maybe. I don't know if it's a myth or no, that you will tell me, but people have a myth that if we pop Ayurvedic herbs or something, we might actually have a bad stomach or something like that. So is it true?
So if we are taking an Ayurveda medicine, make sure that you actually get it prescribed by an Ayurveda doctor after a proper consultation. Taking a random Ayurveda medicine by the suggestion of maybe a chemist or maybe somebody else, maybe somebody you know in the family, or maybe a prescription that's been done for somebody else may not be the right way to actually go to Ayurveda, right? So that is what we tend to do. Sometimes we get advice from our family. Sometimes we get advice from a friend.
Correct, yes.
Like I said earlier, for each person, the set of imbalance might be different.
Very different, yeah.
And therefore, the prescription have to be different. So a medicine which had worked fine for your friend in a particular case may not be the right one for you, because you have a very different metabolic structure. Your functioning is entirely different. You are that person at all. So Ayurveda takes into consideration about your uniqueness. So it is very important that you go to a Vaidya and get a consultation and then have the medicines prescribed for you, because then that would be right for you, that would be unique to you, and that won't cause any stomach issues.
Yeah, because now you know that it's made for you.
It's made for you. So the issues usually happen when a doctor has not consulted you and not taken in consideration about the gut health that you have, right? So your gut health might be different from somebody else.
Correct.
So you might need a special consideration. So you need to have a very specific set of medicines. So that consideration would be done by a doctor, and those medicines will not upset your stomach.
So we can say it's a myth.
It's a myth, of course.
It's a myth, okay. So what is Panchkarma? I've heard about it, but how does it relate with lower back pain? How do you treat lower back pain with Panchkarma?
So Panchkarma is one of the treatment modalities in Ayurveda. So as the name suggests, these are five karmas, right? So they are part of the purificatory therapies of Ayurveda. So if you broadly look at Ayurvedic treatments, there are two ways in which you can treat a person. The first one is called Shamana, or pacifying therapies. And the second one is called Shodhana, or purificatory therapies. So we discussed earlier that we look at the imbalances in a person of qualities, and we call them doshas, the set of qualities as doshas. So when these imbalances of doshas are above a certain threshold, we may not be able to address them with just medicines. At that time, we might have to use certain therapies to actually cleanse our body, right, of those excessive doshas or excessive qualities. The modality used for that purpose is called Panchkarma. There are 5 procedures. Basically, they are Vamana, Virechana, Nasya, Vasti, and Snehavasti. These are the 5 Panchakarmas that we use. And these would help us to actually cleanse your body, restore balance, and feel healthy again. Okay. Right? This is a modality that is used. In low backache, many of the modalities I just mentioned are being employed. For example, Vasti, or which is applying medicines through the rectal route, or a Virechana to do medicated purgation, are all employed to achieve certain goals of treatment. Now, this is not necessary for everybody. Sometimes you might not need a Panchakarma at all. You might be using some other treatment protocols and procedures, but in some people, it might be necessary. So your doctor would be able to tell you if you are in requirement of these Panchakarmas.
Okay. There's also a question which comes in my head, is that people who are actually taking Ayurvedic treatments, should it be integrated with modern medicines too if we talk about low back pain?
I don't think it is advisable to take 2 streams of medicine at the same time unless it's properly vetted by doctors on both streams. Now, if you're talking about integrative medicine, that is actually a new front that is developing right now to use effective protocols from both medicines at the same time to come together. So integrative medicine is something which is slowly developing and which has, I think, has a lot of applications going forward, because in traditional medicine, not just in India, across the globe, if you see, there are effective protocols in traditional medicine which could be used. You might have heard about how China have used their traditional medicine in treating COVID. India has also extensively used Ayurveda in treatment of COVID as well.
Correct, yes.
So there are ways in which we can integrate different systems to come together and treat certain diseases for the benefit.
Yeah.
Now, this should be done with proper medical guidance, with doctors from both systems coming together and helping to treat as well. Other than this, taking a medicine of Ayurveda and along with any other stream of medicine, say allopathic, may not be the right way to go about it, because you might not be considering the interaction between these medicines and how they affect your health. So the right way to do it would be to consult a doctor and get medicine in that particular stream. So mixing them both would not be the right way. Your Ayurveda Vaidya or your allopathic doctor would be able to tell you which to go for. So if you're switching to Ayurveda, your Ayurveda Vaidya would be able to help you to taper down the medicines or to let go of the other medicines and be on Ayurveda medicines at the same time, so that you can be on Ayurveda medicines.
Good.
So other than that, unscientific mixing up of medicines may not be for your benefit and might cause serious risks.
Correct. So people who are actually like hiding the doctors that we are actually on other pills is a very wrong thing and a wrong approach to make. But it is prevalent in the society about the integrated part, right?
Yeah. So, that's a very prevailing stuff. Yeah. You heard about the saying, don't, close anything from your doctor and your lawyer. So it may not be the right way to go, because we are trying to make you healthy. So the intention is that. So actually, it's better to disclose what you're doing, not to take different streams of pills.
Because they are doctors for a reason. I mean.
So don't take different pills simultaneously. That would be a very bad idea.
So when we talk about Ayurveda, people often feel that how much ever we intake the medicines or the herbs, it's very natural, so it's not going to have any side effects. So people also might have a myth about it. So let's just do a myth buster here. So is it true that it doesn't have any side effects?
I would say it is actually a myth that Ayurveda medicine does not have any side effects. Anything that has an effect will have side effects. But if you are taking Ayurvedic medicines with proper consultation of a doctor, in the right dosage for the prescribed time, I can assure you they are 100% safe and does not cause any side effects. In fact, there would be side benefits rather than side effects, right? Any medicine that you take, be it Ayurvedic or anything else, you take it for a very long time without medical supervision can cause undesirable effects. So you have to make sure that you're having the right medicine with the right intent in the right dosage with the supervision of an Ayurveda doctor.
So your organization, which is the Arya Vaidya Pharmacy, what is it? And also tell me, how does it actually look forward in treating lower back pain?
So the Arya Vaidya Pharmacy, Coimbatore, is an 8-year-old Ayurveda company. It is founded by Vaidya Rama Warrior. It focuses on authentic Ayurveda. We are an Ayurveda company from the south. We provide our services through our clinics, hospitals and treatment centers. We also produce 800 odd Ayurveda products and medicines for Ayurveda doctors to prescribe for the treatment of patients. We also have research foundations. We also have Ayurveda schools to educate and spread awareness about Ayurveda. So the way that we treat low backache is in the way that the Ayurveda prescribes it. Like I said above, it includes various elements of treatment, including dietary changes, lifestyle changes, and medicines, of course. Sometimes it can also involve treatments at a treatment center or at our hospitals as well.
So, doctor, why would you suggest people to go for Ayurvedic options and treatments rather than everything prevalent or available in the society?
For starters, Ayurveda treatment for low backache is very effective. At the Ayurvedia Pharmacy, we treat more than 100,000 patients a year with low backache, and our success rate is quite good. So, to have effective treatment, Ayurveda is a great choice to have. But more than that, Ayurveda treatment is not just focused on making you go painless. It is actually focused on making you a better human, health-wise, in all aspects, be it psychological, be it physical, in every way that you have. So it aims at making you a more well-rounded, happy human being so that you can enjoy your life to the fullest. So Ayurveda has that holistic approach, not to, just heal the disease, but actually heal the person that you are.
Yeah, from the root level.
From the root level, and making you more healthy, making you more happy and content about life. Therefore, I think this is the right way to choose so that you can be healthy and you can explore your life to the fullest.
Understandable. Also, when you talk about the success rate, I think it's very high. And that also makes me understand it's one of the best options a person can go for at any stages. As you probably mentioned, that it's never late and it's never early. So it's just like we understand about it. And I am sure the viewers who are watching this podcast will understand the 5 doshas, like various topics that we have actually talked about. And with that, I would love to just conclude our podcast here. It was lovely talking with you, Doctor.
Thank you. All same here.